Meeting is recorded. You've got about 80 and several more popping in.
All right, great.
Right.
Well, good afternoon, everyone. Thanks for joining us today. I hope most of you have some nice snow out your window. For those of you who don't know me, I'm Emily Beauregard. I'm the Director of Kentucky Voices for Health and a member of the Thrive Kentucky campaign. We're really excited to be hosting our second forum with the Cabinet for Health and Family Services, and this is the first one of the new year. Our goal with these quarterly forums, as always, is to create more open dialogue between cabinet leadership, advocates, and consumers. And we really want these forums to be an opportunity for you to get the latest information on the state response to COVID-19, to hear updates on safety net programs, share feedback, and ask questions. So many of you should already be familiar with, I just ended my slideshow. Let me start that again. Many of you should be familiar with the Thrive Kentucky campaign, but I know we often have new people on our calls from month to month. So for those of you who aren't, hopefully my screen is back up. Our Thrive Kentucky campaign works to make systemic change so that all Kentuckians can thrive. And we do that by working on policies that meet the basic needs of every Kentuckian. We strongly believe that the only way for all Kentuckians to thrive is through anti-racist and anti-poverty policies that will lead to a more equitable and just Commonwealth. And we know that Governor Beshear and his administration have committed to pursuing policies toward racial justice and health equity. And so we are just really delighted to have this opportunity to partner with the Cabinet on these forums. Here's the agenda for today's meeting. We'll start each section by giving our guests from the Cabinet the floor to share any updates or information they'd like advocates and consumers to know. Then we'll follow this with some discussion and moderated questions from our Thrive Kentucky partners. And during each section, we'll be sure to put any questions or you should put questions or comments in the chat. We'll be sure to cover those as we go. And if we have too many questions to cover in the next 90 minutes, then we'll make sure to get answers in writing to those questions that we can share as a follow-up with you. So don't let the clock stop you from asking your questions. And before we begin, just some quick housekeeping. We do have a lot of folks on the webinar this afternoon, so please be sure to mute your line. We'll also be recording this webinar and sending out the recording along with any materials that we might be touching on today in an email along with an evaluation. So you can tell us what you thought of the webinar, what you'd like to see during our next quarterly forum, and you should get that tomorrow. And then with that, I am going to turn it over to our first speaker, Dr. Sheila Schuster, who's going to talk about the General Assembly.
Thank you very much, Emily, and welcome to you all. The timing of this forum is excellent because the 138 legislators will be returning to Frankfurt tomorrow for the phase 2, they call it, the second part of this short session. In the first part of the session, in the first 2 weeks in January, they borrowed 4 days. They usually are only in 4 days. So we have only 22 days between February 2nd and March 30th to conduct business. And we really appreciate the willingness of the cabinet leadership to meet with us and discuss many of these important issues. I also want to tell you all that Emily and I have been working since before the session started on getting information out about the accessibility, since we're all kind of banned from the annex and the Capitol buildings because of COVID. And we just got an important update from Jay Hartz, who is the director of the Legislative Research Commission. There is now a way to register online if you want to make comments in testimony during the committee meeting about a bill. And we will be sending that information out first thing tomorrow morning. There's a link that you can fill out, a very simple form, but it is one of the questions that we've had over and over again. So I sent Jay a thank you from all of us for posting that and coming up with a good solution to make sure that the people's voices are heard during these committee meetings. Let me turn to the cabinet and see if they have any updates. I'm particularly interested in if there's been any word on the waiver for substance use disorder treatment for incarcerated folks, and any other updates that they would like to provide at this time around General Assembly or waiver issues.
Lisa, you want to provide the update on the waiver?
Yes, the 1115 waiver for substance use disorder treatment with CMS right now. They are reviewing, and we are awaiting information from them regarding the status of the application or if they have additional questions.
Okay, the comment period has closed on that, I believe, Commissioner Lee. So you all are just in a waiting form like we are, I guess.
Yes, we are. We're waiting on CMS. We think they may come back with some additional questions, but we're not sure at this point, you know, what they, you know, they did just go through a change in administration. So
Right.
they don't even have, as far as I know, a director of CMS yet. So just kind of sitting back and waiting on them to respond to our waiver.
Okay. For those of you who are new to the forum, this is a waiver that would actually put Kentucky among the leaders of any state in providing Medicaid reimbursed services for substance use disorder for those who are incarcerated. And so there was an active comment period here in the state, and now it's at the national level. So we're very anxious to hear back from CMS, or I should say, I guess, the new CMS, so that this thing can get rolled out and those questions that we've raised can be answered. Thank you, Commissioner. Any other updates from the cabinet?
Well, Sheila, as you know, House Bill 50, Senate Bill 55 does remove, the co-pays for MCO. So certainly, that the cabinet's supportive of that bill. And then House Bill 183, you want to talk about that a little, Lisa, about the hospital payments?
Sure. Yeah, so House Bill 183 will allow us, it's basically a financing mechanism and quality measures for hospitals. Currently, we allow the university hospitals to operate this financing mechanism to bring federal funds into the state. So what we're doing now is expanding that financing mechanism to other hospitals across the state, which will allow them to get the average commercial rate for payments. Now, in order for them to do that, there are going to be certain quality measures that they're going to have to meet in order to draw down those additional funds. And it's not something that they can just automatically obtain. They will have to meet measures in order to prove that they are providing quality services to our members in order to obtain those additional federal funds.
Is there a role in that, Commissioner, for advocates and consumers and other stakeholders?
Well, I believe so, Dr. Schuster. I think, that it is a financing mechanism that is tied to quality. So if this group would like to get together some quality measures that they think should be incorporated and send those to me, the department would definitely look at those quality measures that you recommend and see if we can get those incorporated into this financing mechanism. And again, those measures should be, the quality measures should be something that's specific to Kentucky and also something that we can measure. So definitely would appreciate your input on anything that you would recommend as it relates to quality.
Yeah, that sounds like a delightful invitation from you. We appreciate that. I guess I would also ask, that sounds like it would be at the front end when you all are actually laying out what those quality measures would be. What about during the process of the hospital's reporting or gathering that data and reporting? Is there some mechanism, again, for stakeholders to be involved in evaluating whether they've met those quality measures?
Again, just giving us those quality measures that we need to look at going forward. I don't know, Carrie, if there's anything you would like to add about that, about the upfront process.
Yeah, certainly, we want your input on maybe what those measures should be, but on the back end about evaluating them, I'm sure, there'll be national standards, Sheila, or, some type of mechanism to identify whether the measure was met, and plus we need to see what those measures are too. So I think it's a little premature, right now to talk about the back end until we find out what those measures are.
Okay, I know that KHA has a committee, because I serve on it, around safety measures, for instance, and they have, I'm on there as a consumer rep. So I think that would be something, again, that we would be interested in, but we'll concentrate for right now on submitting some ideas around quality measures to you all. Appreciate that. We wondered about the emergency orders that were passed, or the bills that were passed in the first part of the session, that would certainly constrain the governor in terms of the emergency orders that are in existence around COVID, essentially saying that they could only be in place for 30 days, which obviously doesn't match the, what are we in our 10th month or 11th month of the pandemic, and wondering what the cabinet might be hearing about the override of those vetoes. We're very concerned about some perhaps unintended consequences. For instance, the loosening of the platforms for telehealth. I understand from the commissioner that Medicaid will not be affected because those are directly from CMS, but they certainly will affect, as I understand it, the commercial plans. We're worried about professionals who have come in from other states under the emergency orders to provide care here in Kentucky. And a specific thing is around the home health orders that the nurse practitioners and physician assistants have been able to sign. So I wonder if the cabinet is, what your thinking is at this time in terms of the possible timing and some of those gaps in services.
So, this is probably go ahead. Was it? Okay. The governor just recently vetoed those, and at this point, it's premature, for us to make any type of comment, Sheila. So,
Well, you certainly, I understand that you certainly would not begin to predict what the General Assembly is going to do.
What the General Assembly is going to do,
yes.
or
right.
even what our plans are, So at this point in time, it's just early, too early. So
I guess I would ask if the cabinet's aware of some of these potential gaps in services.
We are, yes,
okay.
we're aware. So.
All right, because we certainly have tried to make that known to you. Let me move on to House Bill 140, which is the telehealth bill. The sponsor is Representative Deanna Frazier from Richmond, Kentucky. And I wonder if there's been any discussion with cabinet. I know that there's been some discussion in the various TAC meetings about how important telehealth has been. But I just wondered if there was any coordination or any contact with Representative Frazier about that bill, or any position that the cabinet's taken on it.
So yes, the cabinet, I think Kelly Rodman, has been in contact, so, and we are neutral on that bill as well. So are you all working with them?
Yes, we are trying to work with them, and we had been in touch. I think there's some things that need to be clarified, particularly on the behavioral health side, to make sure, because as you know, and certainly as Commissioner Lee knows, telehealth has been absolutely a lifesaver.
Oh, it has.
Behavioral health
it
side.
Really has, yeah.
Yeah, I mean, our community mental health centers went from probably 2% of their services being delivered via telehealth to now probably 98% being delivered that way. So we're very anxious for this bill to get it right. So I'll check with, or we can check with Kelly Rodman.
Okay.
Yeah, that would be
she might join later, but yes, okay. If not, please reach out to her, Sheila.
Yes, yeah, we will definitely do that. There's a whole series of bills that I'm hoping that you all are aware of that are essentially anti-vaxxer bills. They've been out there, put out there, Senate Bill 8, 37, and 98, and 117, and then House Bill 36 and 101. they're put out like they're about the COVID vaccine, but they really are not. They would roll back requirements for vaccinations as we know them here in the state, certainly for students getting ready to go to daycare or school, and wonder if the cabinet has studied those bills and is taking a position on them.
Yeah, I mean, we have looked at those bills, and you know, here at the cabinet, we are pro-vaccine. So, you know, if you want a vaccine, we think you should have one. Unfortunately, there's not enough supply, so you know.
Yes, well, you certainly are, but I assume that you're also pro all the other vaccines that have been in Kentucky statute for a number of years.
Yes, we are. Yes, we are.
For those in the forum, if you're interested, we have a sign-on letter going to the legislature about some of these bills from various groups. So let us know if your organization is interested in joining in, raising your voice with concerns. There are a lot of both health professional groups and education groups, as you might imagine, who are sounding the alarm about these bills. And the final one I would ask you about is the budget. Certainly the budget as it's being discussed now in conference committee looks very different from the budget that the governor first put out. And we just want to be sure that the budget as you see it now in conference committee is not going to create any cuts in Medicaid or any of your other programs. We want to be sure that those services are adequately funded at this point.
Eric, Lowry, do you have any comments about that?
The only comment I can make is that the budget that has made its way to conference committee, the legislative changes, basically flatlined, excuse me, the budget from House Bill 352 at the previous session. And what I've been told by multiple people is that the changes were just made to get the budget to the conference committee.
Right.
We are expecting the budget to be much closer to the governor's recommended than its current state is, but we're monitoring it actively and very anxious to see what comes out of committee.
Well, I certainly hope you're right that it's going to be much closer to what the governor had proposed, because he had some important things in there. You know, with my work with the Disabilities Coalition, he had increased number of slots for Michelle P. and the SEL waiver, which are critically important for us, and as well as other things. So we will be keeping our ear to the ground as well and trying to weigh in as much as we can from an advocacy standpoint to make sure that all of the services that the cabinet provides are adequately funded. And I think that takes us through all of the bills I had on my list. It's going to be a busy 22 days. In fact, we're going to have a hard time keeping track of everything, I think, but I do appreciate having the opportunity to hear where you all are, and certainly appreciate the invitation to submit some quality measures for House Bill 183. Thank you very much. And now I'll turn it over to Emily to talk about COVID-19 vaccinations. Thank you.
Thank you, Sheila. Well, I think we all know that the vaccine rollout has been a Herculean task, and despite having the public health guidance in place, there continues to be a nationwide shortage of the vaccine, as well as other operational issues that have really slowed the rollout from what we were anticipating. And in addition to these challenges, numerous bills filed in the General Assembly, like the one we just discussed, Senate Bill 8, would greatly weaken immunization requirements, and that could really reinforce or even exacerbate the vaccine hesitancy that already exists, and which we know is more prevalent among communities of color, rural Kentuckians, and the disability community. And along those same lines, we know that throughout the pandemic, Kentucky correctional facilities and other congregate living settings like shelters have been breeding grounds for this disease. And many of us are worried that the vaccines are still not getting to those highest risk communities first. We've submitted a number of questions to the cabinet related to congregate living. in particular people who are incarcerated or experiencing homelessness. We've also submitted questions related to vaccinations for Kentuckians who are not US citizens. And since that population is particularly at risk, unfortunately, no one from the Department for Public Health was able to be on our call today, but we really appreciate that Deputy Secretary Carrie Banahan is with us and can give us a quick briefing on the vaccine rollout. And Carrie, I know that most of the questions that we've submitted are still in the process of being answered, but what can you tell us today about the vaccine rollout plan, and especially as it pertains to higher risk populations and vaccine hesitancy?
So last Thursday, the governor had announced a new location at the Kentucky Horse Park, kind of a mega site to begin vaccination this week. We've also launched a vaccine website. It's vaccine.ky.gov. You can go to the website, enter some information about yourself, and it will identify the level where you fall under the vaccine categories. We also opened up a call center, the COVID-19 Vaccine Management Call Center, where if individuals don't have a computer, they can call our contact center and they'll be able to tell you what category you fall in, as well as assist you in signing up for notifications. We also, on our COVID-19 website, on the landing page, if you click on vaccine information, it will take you to another landing page where there's information there about where and when you can get a vaccine. We have vaccine statistics on there, our vaccination plan here in Kentucky, and other vaccine-related information. It also indicates the different categories. Right now, we're focusing on categories 1A and 1B. All residents in our skilled nursing facilities have received their first shot from CVS or Walgreens. 2/3 of our assisted living facilities have received their first shot as well. And vaccinations, are currently being provided to those personnel K through 12, and we hope to have that accomplished through, I think it's the first week in February. So right now, we have 35 regional centers where you can get a vaccine. And I believe this Thursday, the governor is going to announce some other locations. I'm happy to say, it's tough, getting the supplies. We're in the same boat as other states. There's just not enough. But we have administered 409,797 vaccines. And of those, 351,000 have been administered statewide, and 58,747 have been administered for long-term care facilities. And the goal of our administration is that at least 90% of all vaccines received are provided. You get a shot in the arm at least within the 7 days of arrival. So, patience, we just ask for everybody's patience. Eventually, everybody will be vaccinated that wants to be vaccinated. Hopefully, with the, Johnson & Johnson vaccine, that's going to give us, more options for people to get shots here in Kentucky. And public health, those questions you did provide, Emily, hopefully we'll get those answers to you the end of this week that you can share with the group.
Yeah, that would be great. And as this webinar goes on, if people have other questions about the vaccine, please just put them in the chat and we'll make sure to put those to Carrie so that public health can get answers for us. And I just wanted to ask one other question, which I didn't think to ask in the questions I already submitted to you, which is about communications. If there's any messaging guidance that the cabinet can share with us, I think that would be really helpful so that we're all sort of saying the same thing, sharing the same information, and really being positive about vaccines. So that would be another request that we have.
Okay, will do.
Thanks. And I'm going to go ahead and turn it over to Dustin.
Sounds great. Well, so my section is really just about sort of the shifting financial landscape that we're finding ourselves in. There was a pretty sizable relief package that was passed in December that provided some funding for health measures and childcare. Of course, the governor proposed a budget which included additional Michelle P. and SEL slots, more social workers, and some other enhancements to CHFS. And then, of course, we also have a new administration federally who are doing some things administratively. So we wanted to hear some from the cabinet about what these, this new shifting landscape meant for the services that are provided here in the state and for the good work that they're doing. So I'll open the floor to folks from the cabinet. I'm not sure who is fielding this question.
I guess Eric Lowry, you want to speak to that?
I will what I can. Of course, the governor's budget had, as you said, a lot of wonderful things such as SEL slots, Michelle P. slots. There was additional funding for local health departments that have been chronically underfunded over the years. There was significant funding to fund their quasi-governmental retirement costs. We're very hopeful that some of these things will go forward. As far as going forward with the additional federal funds, we don't anticipate there will be a problem getting the budget authority for those. It's just a matter of getting the grant awards in from the federal government. Right now, we only have just a handful of grant awards that have come in. So a lot of these funding initiatives like the child care grant funds or some of the substance abuse dollars, those we have not received yet from the federal government, but we anticipate them to come in short order.
I'm curious about the child care money in particular. It looked like there was a sizable increase in the amount that the federal government's providing to help with child care centers, which have sort of been struggling for years, and obviously the pandemic has added a whole new level of stress on that industry. Are there any particular plans for how to use that extra money right now?
We are working on plans, Dustin, and hopefully we'll be able to share that with you all in the near future.
Okay. The other question I had was just, the president has signed an awful lot of executive orders trying to respond quickly to the pandemic. Have there been any federal administrative actions that have been taken in the last, couple weeks now that you all anticipate being helpful or changing the way we're doing business here in the state?
I mean, they did extend, the state of emergency, I think, through the end of the year. So we'll continue to get the increased FMAP rate, of 6.2%, and that will be a tremendous help. Eric, do you have anything to add?
No, you've covered it.
Eric, do you, just out of curiosity, do you have an approximate amount that we have, I guess, lowered the amount that we would have spent otherwise from the 6.2%? I think it was retroactive to the beginning of 2020. So we have a full 12 months of that now. Do you know what kind of dollar amount can be affixed to that?
I don't have it directly in front of me, but it averaged about $40 million a month.
Great. Okay. That's helpful. All right, then I will hand it off to Jessica unless the cabinet has anything else they want to add.
Great, thank you. I think we're going to move on to SNAP and PEBT, which is my section. So with an estimated 37% of adults in Kentucky experiencing difficulty covering usual household expenses, it's no surprise that food insecurity has also been an issue. Significant supports have been made at both the federal and the state level to address food insecurity, everything from minimizing in-person appointments to extending SNAP benefits by 15%. We also know that the PEBT program, Pandemic EBT, has provided over 600,000 students with grocery money to make up for meals missed in school. And we know that there are probably recent changes around that as well. So with that, we submitted a few questions. I think Jason Dunn is going to provide an update for us on those two topics.
Yes. Well, let me start with PEBT. We're kind of in a hurry up and wait mode right now. We have submitted our plan to the feds to be approved. The feds have they have approved a handful of plans for some other states, and I know we start to feel the pressure when you see Illinois, Indiana, Ohio, and Tennessee being approved for PEBT. So we hope that we can be approved soon. Tennessee took about a month to get approved, but they also submitted their plan right before the holidays. So it's really hard to gauge, if that's a reasonable timeline to expect or not, or if we can hopefully get approval more quickly. They just recently resubmitted guidance for PEBT. We were told that states wouldn't have to resubmit if they've already submitted under the old guidance, but they'll look at approving that with an eye towards what their new guidance says as far as simplified assumptions and everything. We're trying to make it very, very simple, but that means FNS may not like it because we tried to make it very simple. We don't know. So what happens from there once we do receive approval? We really can't do anything right now because we can't go too far out ahead of the approval, because if the approval's conditions are different than what we submitted or what we thought would be approved, we'd have to change everything around. So we're waiting for that. We're in the process of getting our communications together so that we can be fairly proactive with how to communicate once it's approved. Of course, those communications are also dependent on what that approval looks like. So, we might have to make changes to that too. So it's not a fast process, unfortunately. I think, I hate to give a timeline because as soon as I give a timeline, it's not going to be correct. So just know that we have submitted it. As soon as we get any questions from FNS, that's the Food and Nutrition Service under USDA, we will, be very responsive to those and want to get approval as quickly as we can. So that's about as far as I can go with PEBT. I know this says something about August and September. We're still dealing with some August and September issues, with people who didn't receive their card or, just some corrections being made. We're still handling those on a case-by-case basis at this point.
So Jason, once they do approve this latest submittal for, I guess, October, November, December, so, we're into February. So, but once they do approve it, will it be easier to approve, maybe January and February for, subsequent filings?
Well, the way we submitted the plan, and I just want to be careful about how I submit it. The way we've submitted the plan, pretty much everybody, because most of the state was in a red category for COVID, almost all students across the state would be eligible for a 20-day period each month. And we're looking at least October through January as one chunk. But once we receive the approval, the plan is for SNAP beneficiaries, those benefits will go directly to their SNAP EBT card, not the pandemic EBT card. For those who received, who are non-SNAP recipients, we'll put those benefits on the PEBT cards that we've already issued. If people have lost or thrown away those cards, we can reissue those cards, and we'll be set up to take care of that. But we're erring on the side of automatic. It's kind of a hybrid of the first round and the second round. SNAP to SNAP folks on their SNAP EBT, and then an auto issuance for non-SNAP recipients. So that is the plan for now. We'll probably issue a month at a time for every 2 weeks, just because we don't want to flood the SNAP retailers with all those benefits at one time. That would cause chaos in the grocery stores. So So in order to not have some folks wait longer to get their benefits, I think our plan is for everybody to get their October benefit and then a couple of weeks later get their November, and just every 2 weeks until we're caught up. That's the plan.
Thanks, Jason. And I know you can't say too much about the application because it still hasn't been approved, but we do have a few questions from parents. So what should a parent do if they've lost or thrown away their card? Is there anything they can do now to prepare for the next round of PEBT?
You know, I don't know if there's anything we can do proactively. That's going to be a question I'll need to take back to my team to make sure, because I don't want to guess on the answer on that. If there is something we can do now, that's great. I don't know if we can until the new benefits are issued. I don't know that our EBT vendor can send out a card without a benefit on it, if that makes sense. So, but I'll follow up on that.
Okay, and then a kind of a similar question. What about for new students who have never participated before, like they're a kindergartner or something like that coming into school for the first time? How should they go about getting PEBT in the future, or where should they look for information when it comes out?
So the file we get from the Kentucky Department of Education will have any student on it. It's going to depend on the timelines and everything, but you know, like say if we're doing this at the end of February, if we're getting ready to send the benefit out, we'll get that file from education, and it'll include any student from the beginning of the 2021 school year up until that point in time. So new students should be included. Of course, we do have you know, students that move in and out of the state, you know, that would be a new student. If that happens later in the school year, they'll be picked up in another data file down in the school year. Again, on the timing of when the benefits will be issued, I'm sorry, until we know, until anything is under our control, I'm hesitant to give a deadline at this point. And just because you see other states being approved doesn't mean they've issued their benefits yet. They may be in that time period where they have to get their data ready too, just like we'll have to do after we are approved too.
So Jason, there was a question. You had mentioned that the PEBT submission included January. So is it October, November, December, and January?
Probably by the time we receive the approval, that first file that we sent to our EBT vendor will have all 4 months on it.
Okay, all right, thanks.
Right. At this point, it might have February on it too, because we're.
Okay, well, that's even better, Jason.
Right,
Okay,
right.
okay.
Okay, thank you. Last question on PEBT, and then we can move on to SNAP. So the USDA recently announced something about expanding PEBT benefits 15%. Could you say what that would mean for Kentuckians?
It's pretty simple, thankfully. We have a meeting with FNS tomorrow to talk about all these changes that they've made. But I think what it means, all it means is that the $5.86 per day, we just multiply that by 115%, and that's our new daily amount. So it's pretty simple. We haven't sent the benefit out, so we can make that change before we submit that file to our vendor. So that one will be a quick win, thankfully.
Great. Okay, let's go ahead and move on to SNAP, and I'll go through the chat as well to see if there's additional questions.
I see some additional questions too, and I'll try to answer some of them. Maybe we can do it in the chat if we need to. So
great.
Yeah.
Okay, so the SNAP 15% increase for benefits was also announced in the last federal relief package. Has that been implemented, and who could see benefits from that?
Yes, all SNAP recipients received the first 15% supplement on January 21st or 22nd, I believe. It was week before last. We were able to issue those for this whole time period. You know, that 15% is only effective through June. So rather than make two major changes to our system's accounting database, we're just going to issue those as supplements for all 6 months. So the way it should work, forget January because January was weird. You'll get your regular benefit as a regular issuance. There will be a supplement for 15% increase of your regular benefit. And then as long as we're eligible for the maximum benefit, we'll issue that maximum benefit as a third supplement. For most folks, you'll see them all come at the same time. February, we couldn't get them in until the 4th of the month, but for following months, it should be on the regular issuance date.
Great. And then the SNAP emergency allotment, has that been approved for February?
Yes.
Okay.
We're approved for February. We're all set. For those who don't know, states have to apply for that every month. This is something I have to get in. It is dependent on a state declared state of emergency. So if the state declared state of emergency wasn't in place, families can't get that maximum benefit. That's all I'll say about that.
Thanks,
I
Jason.
think what you're saying is that would be executive authority,
Right.
which could be potentially
If,
hampered by some of the bills that were recently vetoed, right?
yeah, we have to verify each month that our state declared state of emergency is still in place. You know, other things that are based on emergencies, like the not having to comply with the work reporting requirements for the adults without dependents or any known disabilities, that is dependent on the national declared state of emergency. So it's a patchwork quilt of requirements. So you can apply. I'm going to answer this one real quick. You can apply for regular SNAP by going online. The easiest way you can do it is go online to KYNECT Connect. That's KYNECT.ky.gov. I'll put it in the chat. There's also a phone number you can call for us to talk to a worker that way too.
Thanks, Jason. I am being told we have a little more time, so I'm going to ask some of the PBT questions in the chat. You can feel free to plead the fifth, but I'm going to go ahead and ask them.
Okay.
So with the PBT benefits, will they go on current cards? Will they have the kids' names on them, the parents' names on them? Do we have any information about the cards?
It'll be one with the kids' names on it. You know, that first time we set up an application process, and that was basically to be able to group students together and minimize how many cards we sent out. The second time was just much easier. It was faster to automatically issue those in the student's name. So, yeah, look for those. When the benefits come, they'll be on the student's card. That second card you got. I think there were some others. But...
Yeah. Okay, one was asking about the timeline, and I think you said October through January now, could be February, depending on when the plan is approved.
Right.
Okay.
And then once we get that first chunk of several months, however many months that is at one time, then it'll be a month-to-month file that we'll send to our EBT provider.
And I see one question asking, have SNAP applications changed at all?
Well, you know, there are some other waivers that we got based from the continuing resolution in October, and then they were to help states with administration of the program. So there's not an interview requirement right now, although if you call our number or go online to connect.ky.gov, that's how we collect the information anyway. So there is kind of a de facto interview for applications, but right now we have pushed back our certification periods on cases. So if your case was due in October through June, October last year through June of this year, your case was automatically extended for 6 months. That was to help both the state and recipients. That means the folks who were due in October, we can't give you another 6 months. So those cases will come due in April. So we'll have some recertification work to do in April. But but everybody was extended 6 months, given 6 months additional time without having to recertify. So those were the other major changes that we had. Another change that doesn't affect recipients directly, but we didn't have to continue to be held liable for our quality control ratings. We've accepted that waiver, and that's was going to be through September, but the CA Act that was just passed shortened that to June. But we're still doing those reviews. We're just going to concentrate on the cases that usually cause us the highest amount of errors, and hopefully come out of this with higher quality casework than we had before, which we were already pretty darn high. We're by the end of this year, we'll be 5th or 6th in the nation as far as having the best quality casework rate. So we're very proud of that. That means we're doing things right with our casework. So I was very happy to see that, pleasantly surprised to see that. So, but we'll continue to make sure that quality is a really important part of what we look at in our program.
Thanks, Jason. And then the last question I'm seeing, so can you be a little more clear on what the governor's ability to declare a state of emergency would do? What is the emergency allotment for SNAP?
The emergency allotment brings every household up to the maximum amount of SNAP that can be issued for a household. So before this 15%, the maximum amount for one person receiving benefits was $204. If they have any kind of income that made their SNAP issuance less than $204, say they were only eligible for $100, then we were issuing the emergency allotment, gives everybody a supplement that raises them up to the maximum benefit level. So they would receive a $104 supplement to make them eligible for all $204 for that month. It's really been helpful for a lot of our senior families, our senior households that may be eligible for, something like $16 a month. That's the minimum amount. They're able to get the full amount of benefits during this time. So they've been very helpful. And I know people are budgeting those pretty wisely because they know that this is not going to be around forever. Just want to remind everybody that you have 9 months to spend those benefits. Budgeting is great, but they would roll off after 9 months if they haven't been spent. So that's just something to keep in mind.
Okay, thank you, Jason. I think we'll keep answering questions in the chat, and I just want to assure everybody that we'll get all of this information updated with Jason either by writing or as the call moves on today. So thank you.
Absolutely. Thanks, everyone.
Hey, Jessica, would it be okay if I clarify one more thing?
Yeah.
It was also in the chat, but I think it got a little lost. So last week, KVH put out some information that we thought we had confirmed, and I apologize if we didn't, about requesting a new card. We thought that there was a way to request a card in advance. So if that's not the case, I think it would be helpful for us to know so we can correct that information. But if there is a process that we can direct people to, that would be great too.
Yeah, and I think some of that might have gotten wires crossed because we were talking about requesting cards for August and September, but maybe we weren't sure that you were talking about, proactively for the next round. So I'll make sure that is answered clearly and we get that out to the group.
I think we can go ahead and move on to Medicaid, and we'll keep answering those questions.
Sure thing.
Hi. So I'm sure that we'll probably lose some folks that probably just came to listen to information about PBT, but I welcome you to stay to talk about Medicaid and what's going on with enrollment and access to health care for folks, because there's a lot of changes. And so I would like to ask the cabinet to set the stage for us around what's happening that's different right now. Right now we're in a period where, open enrollment is over, But at the same time, there's been an extension and people are able to change their MCO if they want to. And also there is a new open enrollment period coming up. So I would like to ask whoever is going to talk about Medicaid and Connect from the cabinet to sort of set that stage for us.
Hello.
Hello.
Hello, Kara. It's Lisa Lee, the Commissioner for the Department for Medicaid Services. And as Kara mentioned, there are a few things going on as it relates to eligibility. First of all, we do have a presumptive eligibility program in place in Kentucky, and presumptive eligibility is not new. It's been around for a while. And presumptive eligibility, we call it PE, was originally designed as a stepping stone to get into the full Medicaid program. The PE provides temporary coverage for individuals who present typically at a physician's office or a hospital, and they don't have insurance, but the physician or the hospital can deem them presumptively eligible. So during COVID, we thought it was very important for individuals to have health insurance. So we allowed ourselves, we requested from the federal government and obtained approval for the cabinet to be able to grant presumptive eligibility to individuals. So it's a very simple form. Individuals can go online and fill out a very online form and get a card immediately that they can print on their computer. We have been noticing that some individuals are reporting income that is higher than the allowed amount. So we will be making some changes to the presumptive eligibility process. So if individuals report that they are over the income, we will deny that application going forward. And then what we will do, as Kara also said, there is an open enrollment coming up on the federal exchange. So our connect.ky.gov, individuals who appear to be over the income limit for presumptive eligibility will be directed to Connect, where they can fill out a full application for Medicaid, or they can see if they qualify for a product on the exchange. So that's one thing that's going on with the presumptive eligibility. The other thing we talked about was MCO changes. Every year by federal law, Kentucky has to allow individuals who are enrolled in managed care organizations to change their managed care company. So we just ended an open enrollment back in December. Less than 1% of the population, I believe, the last numbers I saw showed that less than 1% of the population in Medicaid managed care chose to switch MCOs. So it was a very low number. But due to COVID and due to the fact that we had a little bit of issues and we didn't get information out very timely to individuals, we are telling our connectors and our call centers that if individuals call and they want to change their MCO now outside of the open enrollment period, they can do so without having to fill out forms or justify why they want to change. So our connectors are very well versed in this. So they will be helping individuals who may want to change their MCO. And we definitely like to thank Kentucky Voices for Health for getting that information out to individuals about being able to change their MCOs outside of this open enrollment period. We also, I'm not sure how much time I have. If you want me to give you a few other updates, we are in the process of creating a health equity technical advisory committee. We're identifying potential representatives right now and reaching out to gauge interest, and the governor will ultimately appoint individuals to that technical advisory committee, but we don't have a date set yet right now. So I'm not sure if there's anything else that you all would like to know about that we're doing. I do know that I've talked to Dr. Schuster about, in January, we did move to a single formulary for our members. And before January the 1st, we had 5 MCOs that had their own formulary and the fee-for-service formulary. We chose to adopt the fee-for-service single formulary. And when we did that, we found out that there were some products that the managed care companies were covering that fell outside of our formulary or drug formulary. So we are now reaching out to the MCOs because there were some issues with individuals being denied medications because they fell outside of our new single drug formulary. And when those drugs fall outside, the MCOs have flexibility on how they can administer those products. So we have reached out to them and told them to remove any PAs that require a diagnosis only. So we are working with them to fix those issues related to the single formulary. And I think, unless you have questions, I think that's a couple of the updates that I have right now.
Commissioner, I apologize for not seeing that. I saw you early in the event, and then you disappeared off my screen. So I thought maybe you had taken off to another meeting. So I apologize. But thank you for being here and your time and for sharing that information. I am a connector and very appreciative of the fact that people can change their MCOs, because when someone really wants to, that's they really want to. So I want to follow. Go ahead.
I'm sorry. The one thing that I did forget to mention was we are keeping an eye on the federal level. The Biden administration is looking at increasing the level of postpartum for women who have been in Medicaid. Currently they have 60 days postpartum. So they're looking at actually making that a year. And that would be very important because for Kentucky, that we cover pregnant women up to 185% of the federal poverty level. So those are at 138 and below fall into Medicaid expansion, and they can continue their Medicaid eligibility. But once they fall outside of that 138% of the FPL, then they do not have Medicaid anymore, and they'll either have to get private insurance. So we're definitely keeping an eye on that to see if there may be some movement, allowing us to extend postpartum for pregnant women up to a year. If so, we would definitely have a budgetary impact, definitely have to have some funding for that, but something we are keeping an eye on in hopes that we can move that way in the event that the federal government allows the year postpartum. So, sorry, Kara. I wanted to get that.
Oh, no, you're good. That's very important. I definitely expect that we will at KVH and with our partners that are on this call with, Kentucky Equal Justice and KY Policy, we discussed the importance of people who will no longer be eligible for PE having the opportunity to enroll in coverage with the new marketplace open enrollment. So we're very much so looking forward to hearing the details from that out of the federal government as the SIO and looking for guidance from CHFS about what the plans will be in Kentucky. So what I'm hearing from you now, though, is that since that's not firm, there isn't like a communication plan right yet.
Yeah.
Okay.
Yes.
We'll follow back up with you for sure. I wanted to check back a little bit about the formulary. I'm grateful to hear that adjustments are being made, because right off from the jump, as soon as January 1 hit, we started hearing from people that it wasn't working the way we had promised in our communications. Is there a way that people should be communicating if they are having prescription problems when they go to get a refill based on the formulary change?
Yes, they should definitely, they can come to the cabinet. They should definitely reach out to their managed care organization and make us aware of those. We believe that the provisions we're putting in place right now, instructing the MCOs to create an automatic authorizations for product will help alleviate some of those issues. And we think too that some of it, the ones that we've noticed, in January we moved to a single drug list. We also moved our foster care children to one managed care organization, which is Aetna. They're serving as our single MCO for our youth, and we call that which is serving Kentucky youth. So that, and then during the middle of a pandemic, we had all of this stuff going on, and it was just one of those unintended consequences of moving to that single formulary that we believe was an issue, but we've identified those problems, and we do believe that this will alleviate the bulk of them. But definitely, if you hear of any individuals who cannot get their medications, definitely reach out to their MCO, or they can give us, and I can put an email in the chat for people to follow up with. I mean, if they come to you, Kara, and Emily, or Dr. Schuster, feel free to just reach out to me directly.
Thank you. We appreciate the responsiveness of this cabinet and figuring out and solving problems, and appreciate that you took some proactive moves to take care of that from the jump. I think my last question is, sort of about the broader realities of Connect. Of course, we're not going to be fully integrated in time for this potential open enrollment period coming in February. It'll still be Kentuckians go to healthcare.gov, thankfully for the last time. But what else is going on with Connect? What other benefits and resources are people accessing? I heard some really impressive numbers and would love to be able to sort of share more about what consumers are finding and Kentuckians are finding at Connect.
You know, I can provide you some statistics, and hopefully later this week I'll have more. But you know, since we launched the new website on October 5th, we've had 643,427 individuals access Connect benefits. You know, there has been 64% of the folks that go to that website access it through a mobile device. And we streamlined the application process. So, you know, prior to the relaunch of Connect, it took about 55 minutes to complete an application. Right now, it only takes 20 minutes. You know, it's streamlined, easier to navigate, logical steps, screens are skipped, you know, so a significant improvement over Benefind. So document upload is increased 74% from the Benefind days, which is good news. So overall, I think it's been just a tremendous success. Connect resources where individuals can find resources available in their community for food, for housing, for education. Getting a lot of interest with Connect resources. Trying to find my statistics. So we've completed over 1,102 assessments. We've completed 9,560 referrals to other services, and hopefully by the time we meet on Thursday, I'll have a breakdown of where those referrals were. But last time I checked, it was for food assistance, you know, so you know, top the numbers. We've onboarded 89 community partners, and we have everybody loaded to the system except the Louisville metro area, and that's coming soon. So I know Secretary Friedlander and myself, we have plans to expand Connect resources even more than it offers today. You know, we'd like to direct everybody to Connect resources. You know, we had talked about having maybe a UI link on Connect. So when people were applying for SNAP or Medicaid, they could also at least be linked back to UI to file for benefits there. So, so with that, do you have any questions, Kara?
Thank you so much, Carrie. No, that's really what that is what I wanted to hear about that. I am so excited about the long-term implications of having our resources and the nonprofits in Kentucky that work so hard connected through one platform. It's just like a dream that people talked about forever ago, but no one ever had the resources to pull it together. And so to have the state do that really, really is awesome. I have, I think, one other question that came up in the chat that I think is probably for Commissioner Lee. That is about sort of clarifying the difference between emergency time limited Medicaid that is available to people, whether or not they have a current, you know, immigration status that maybe aren't eligible for a regular Medicaid versus and in comparison with presumptive eligibility PE Medicaid.
So PE, again, is temporary for all services, inpatient, outpatient, covers the whole host of Medicaid services. Time-limited Medicaid is strictly for emergencies and must be certified by a physician in order for individuals to get that emergency. Some emergencies, of course, include ER visits, hospitalizations for heart surgeries, things like that. Delivery of babies also considered an emergency, so that would be covered under the time limited. So presumptive eligibility, even though pregnant women receive presumptive eligibility, it will not pay for the labor and delivery of a baby. That has to be that's generated and paid for through the time limited emergency Medicaid.
Commissioner, is there a sort of blanket policy around COVID, or is that a condition-specific determination with emergency Medicaid? If someone goes to the emergency room who is otherwise uninsured?
So if someone goes to the emergency room, it would depend on the specific emergency and the physician in the ER. If that individual was admitted to the hospital, it could be emergency time limited, but a lot of it would depend on the exact diagnosis and the outcome of that emergency room visit.
That's what I assumed, but I just wanted to clarify. So it isn't an option right now for people to sort of apply for emergency time limited Medicaid for COVID testing or treatment, but it is possible that if you were to go to the emergency department at a hospital or to a doctor's office, I mean, it's eligible for a doctor's office also, freestanding clinic.
I'd have to double check and see if it's a physician, if it's outpatient. Typically, it's hospitalizations, and I know, for example, renal dialysis is covered under the time-limited emergency. So again, depending on the specific diagnosis, but if someone did have COVID, they were in the hospital, they needed to be treated, they were not a documented individual, they would be eligible for time-limited emergency Medicaid while they were being treated for COVID.
We'll keep the messaging going that people should seek treatment and seek the appropriate level of care, because we want to make sure that people, of course, are, especially when it comes to COVID-19, getting the treatment that they need, and for all health conditions. Does anybody have any other questions while we've got the leaders of our state government when it comes to health and family services in the room?
Kara, this is Sheila Schuster. I'd like to come back to a question that Steve Shannon had put in the chat, and I guess it's for public health, but we're concerned about people that are served in the community mental health centers in residential programs. Some of the centers have SCL waiver residential programs, and some of them have substance use disorder residential programs, and yet they have not been treated like the nursing homes have been treated. So we're concerned about people getting their COVID vaccinations.
So Lisa, there have been discussions, correct, with you and Wendy and Commissioner Eldridge about the population, those populations, correct?
Yes, we are in discussions. We have a little group that discusses. One of the first priorities, of course, are those individuals who are not mobile. We are mining our data, for example, for our waiver programs, particularly SCL, for those individuals who often use the stretcher ambulances. So we know that they're not going to be able to go in person to receive a COVID vaccine. So we're concentrating on those and formulating a plan to get our waiver population vaccinated as soon as we can.
Mm-hmm. And I think Commissioner Eldridge is looking at the homebound population, where we provide Meals on Wheels and, personal care services. So they're all encompassed in that category, Sheila. So,
and let's not forget the SUD residential programs. Now they're going to be probably mobile, but once you're in a congregate living situation, as you all know, the chance of passing the COVID around is certainly magnified. So we appreciate that.
And Dr. Schuster, another letter that will be going out today, if it's not going out already, our waiver participants who use PDS, which is participant directed services, those individuals who are performing PDS are actually viewed as employees, and as such, they fall into the medical, the first responder or the caregivers, so they are eligible to receive those vaccines also.
Great. So they would
with medical personnel.
With medical personnel. Okay. That's really good news, because we've again been very concerned. I'm glad you all are collaborating across your different departments and making sure that none of our folks fall through the cracks, but we have been concerned about those populations. So appreciate that. Thank you.
Thank you, Dr. Schuster. And I've read that question. I've read that from Steve Shannon and thought that's a great question, Steve, and then forgot about it. So I apologize, Steve. Anybody else got any questions or anything else come up in the chat that we missed? I don't think there's anybody after me, so that's why I just sort of turned myself into the moderator.
You know, Kara, the one thing I wanted to mention from the chat, well, first, it sounds like people can request a replacement card if they lost their PEBT card or threw it away accidentally last year.
Right.
So Jason has posted that in the chat, and we'll make sure to get that information out to anybody who's dropped off the call by now. The daily rate for PEBT has also changed, and Jessica put that in the chat. So it is increasing, which is great news.
Right. Yeah, I just want to make sure everybody saw that. And just know it's PEBT is one of those things that's easier said than done. It sounds really easy, but it's not. We have to get data from 171, I think, however many school districts that we have in Kentucky. And unfortunately, Kentucky does not have a statewide data system to collect the child nutrition information about free and reduced lunch programs. So, you know, this is one of the things that makes PEBT so difficult for Kentucky and a lot of other states too. I think states that have that statewide system are very fortunate in this regard, but that wasn't, you know, that wasn't something that was thought about by the legislators that passed this, unfortunately, is that it does make it pretty difficult to implement a PEBT program very quickly. So we'll move as quickly as we can with our federal approval once we receive that.
And Jason, I want to thank you. This is Sheila Schuster for your response to my question about if the emergency orders go away because of the action of the legislatures, then your ability to bring people up on the SNAP reimbursements monthly also goes away. So
Right.
That's another one of those unintended consequences that we need to alert legislators to. That was what I was not familiar with.
Yes,
Right.
I can guarantee that people don't know about this.
Yeah. Yeah.
Right. I think it's just one example probably of what we can access under a declared state of emergency that we wouldn't normally be able to access. It's just the one that's that hits home closest to me and is nearest and dearest to my heart, but I'm sure there's many other examples of that.
Well, one of the things we found out is that we have over 1,000 APRNs, advanced practice registered nurses from other states who are providing care here in Kentucky under relaxed conditions because of the state of emergency. And I think there are other healthcare professionals that fall into that. So that's one of the things that we're going to lose if all of this just goes away on Tuesday when they come back into session. So there are lots and lots of those unintended consequences. But this one is new, and we will be sure that legislators know that this is the case. Thank you.
Yeah, well, I want to, unless we have other questions, I just want to thank everyone from the cabinet again for joining us today. Deputy Secretary Bannon, Commissioner Lee, Jason, Eric Lowry. We really appreciate you taking the time to share updates with us and answer our questions. And we will be having our next quarterly forum in May. So of course, a lot will be happening between now and May. There will be plenty of PEBT, I can only imagine, between now and May.
And vaccines too, so
And
more
vaccines,
vaccines.
exactly. We'll have, of course, an open enrollment period, a new special open enrollment period. So there will be a lot for us to catch up on. But in the meantime, we will be putting out updates. If you don't already follow Kentucky Voices for Health or KY Policy, Kentucky Equal Justice Center, and the other groups that are part of Thrive Kentucky, please be sure to do that. I will change my screen so you can see our handles here, social media, websites, and email addresses. And of course, we will be sending all this information out tomorrow, like I said, in email. So if you missed anything, you'll get it there. You're always welcome to email us if you have questions or want some additional information. And we will be putting out an evaluation asking for information that you'd like us to cover during the May forum. So thank you all again, and we'll look forward to seeing you in May, if not sooner. We do Thrive Kentucky state and federal policy updates every other month. So in March and April, we'll be giving you updates, and hopefully we'll see many of you on those. Thanks again, and have a good day.
Thank you.
Thank you all.